My name is Stacy Fuentes. I am going to be the nurse practitioner that's going to be overseeing CTs with contrast patients. I do have background as a nurse in the ER. I will be overseeing CT. Anyone that's coming in with CT contrast, I will go ahead and look at their medical conditions, make sure that they are safe to do the CT with contrast. Just be with the patient, make sure they do not have an allergic reaction, because if they do, that's when I will go ahead and step in, make sure the patient is stable. And again, just stabilizing the patient. I have experience in endocrinology. Before here, I was working at Mount Sinai and I was basically only seeing diabetic patients. With the diagnostics, I did see a little bit of ER, managing patients CT with contrast in case they have an allergic reaction. In case they do have an allergic reaction, it is something that you have to rapidly be with the patient, diagnosing the patient, helping the patient, so that we can go ahead and we can stabilize them. So I did definitely see some emergency medicine with that. When the patient is diagnosed with breast cancer, in terms of breast cancer patients, they will likely need a CT just to make sure that the breast cancer hasn't metastasized anywhere else within the body. That's something that we will be able to see in CT. As well as like lymph node involvement, and also defining the extent of the disease. That referring provider will go ahead and determine what are the next steps for the patient, whether surgical consult, whether they need additional screenings or CT scans or an MRI, which for the most part, that's what it is. They would need an MRI, but everything would be coming from the referring physician. I am definitely excited to be a part of the Diagnostic Center of Miami. I'm excited to be a part of the CT with contrast, seeing those patients and helping those patients, making sure they are safe.